Venkatesh is admitted for dialysis. Opposite him in the ward is 20-year-old Navya, also in for one of her regular 4-hour sessions. Navya at least has the lifeline of a transplant and the chance for a normal life if a donor can be found. Venkatesh is too old to be considered and has no money or insurance. He has no option but dialysis for the rest of his life. After an uncomfortable 4 hours of dialysis, Venkatesh and his wife begin the long and slow journey home. The crowded bus trip across town will take them the best part of 3 hours. Every trip for dialysis takes a day and a considerable toll on his weakening body. For Venkatesh to survive, this will be the routine for him and his wife 3 times a week for the foreseeable future. Despite her busy home life, senior nurse Jessie is doing well in her nurse intensivist course. But today, she must present a case to Dr. Rajagopalan, a prospect that makes the most confident student nervous.
Good afternoon, everyone. Today I'm going to present the patient, Mrs. Bama. She's 46 years. And she got admitted today morning at 6 o'clock with complaint of fever, loose motion, vomiting and body pain. Then history of vomiting, and vomiting since Saturday, and there is no blood stain, and abdominal pain also associated with vomiting. Also she is having abdominal pain.
What is the source of sepsis?
It may be food.
It's a gastrointestinal.
Gastrointestinal.
Because she had vomiting.
She had vomiting, loose motion, gastro GI.
Okay.
And we have sent one blood culture also.
So why is the platelet low?
Can be due to sepsis.
Why is it low in sepsis?
Dr. Rajagopalan puts Jessie on the spot with his probing questions.
So both increased destruction and both increased...
But she's performing well at this difficult level, something Rajagopalan would not have thought possible 6 months ago.
I told you, Jessie did an excellent presentation. I was very impressed. Her presentation. But she has been now thinking in terms of sepsis. She's not able to think. And I don't blame you for that. Doctors are like that too. Unless you're as old as I am, nobody will be thinking about it. That's okay. You know, you didn't do anything wrong.
With the first operation completed, Beamish is moved to the recovery ward. He'll be back at the hospital in 3 months to have the second operation to straighten his spine. But in the meantime, his father can relax and look forward to Beamish's safe return home. the next episode of Indian Hospital, we meet a trainee surgeon just starting his career. 2 Jain monks in need of help. Navya finds her donor.
You really got 24?
And Dr. Rajagopalan
24 and 3/4.
finds something to smile about.